It's that the NSPCC is insisting that more needs to be done to prevent young people reaching crisis point because there has been a rise in self-harming. The NHS figures show the number of girls being admitted to hospital for it has almost doubled over 2 decades. Around 13,500 were referred last year for this. And I just thought that was extremely worrying, really concerning figures. And so I suppose the first question is this much of an issue on the Isle of Man? Is it something we need to be concerned about?
Yes, of course. I mean, we've got to look after our young people. We have all the same sort of pressures here on young people as we do across the water in the UK. Remember, those statistics are UK-wide, so it sounds a lot, but remember we're talking about 60 million people. So, you know, it's not a huge issue, but it is an increasing issue. And I think partly that's down to the fact that we are better at talking about these things. So I think children and young people are becoming less worried, less scared about actually talking about this stuff. And that's great. And that's really what we need to foster, is a culture of being able to go to your local doctor, to your school nurse, to your health visitor, to the children and adolescent mental health services, and talk about what's troubling you before it gets to crisis point. And that's really what we want to be doing on the island in the same way as in the UK. The CAMS service, which many will know about, the Children and Adolescent Mental Health Service, which is a bit of a mouthful, has increased and expanded its services over the course of the last 2 or 3 years. It's now a 24-hour service, and they have inpatient beds. So there's a lot more facilities there than there used to be, and therefore things like the waiting lists are better than they were. So they are services that are experts and particularly appropriate to refer to. So doctors, GPs will refer into that service when a child or a young person has difficulties that the local services can't manage. But the important thing is the 5-year mental health strategy is all about trying to prevent rather than treat. And so what we're trying to do is to set up more services where young people can get help long before they get to the point where they feel that they're bad enough to need to go to their doctor even. So local charities, local support services, school-based services, using the health visitors and the school nurses, all important. There are lots of things out there that we can do to prevent it getting to the point where it's a crisis. And so it's not all in place yet. And so it's important to recognise that we have still got a lot to do. But there's an awful lot more now available in terms of resources, in terms of people to talk to than there was even 5 years ago. So it is looking up.
But I'm guessing you're talking quite a lot there about the young people themselves needing to sort of put themselves forward and go speak to their GP. I would have thought that at that sort of age, you're probably less likely to want to come forward. So it's probably more likely to be the parents who are going to pick up on things like this, isn't it?
It's both. It's about increasing awareness of what's available for parents, but it's also increasingly, particularly for young children, young teenagers, getting the information out into schools and community centres where the children themselves, the young people themselves, can actually pick it up. Many of these young people who are at the risky end maybe don't have quite the relationship with their parents that they'd like to have. That can be one of the issues which makes young people find other ways of outletting their emotions. And so whilst it's great if parents can be involved and can be working with their kids and their young people, their young children, the young teenagers to solve these problems, then great. But also we need to be making sure that the young people themselves have access to and are able to access resources.
And what signs, John, should parents be looking out for?
Gosh, the problem is that it's a whole range of things. I think if your young child, your young teenager has changed the way in which they communicate with you, if you're finding it difficult, as we often do with teenagers, to communicate, if anything's changed significantly within a relatively short period of time, number of weeks or months, and particularly if school or college or whatever is expressing some concerns, then you know it's something that's worth taking note of and perhaps talking to your doctor, your school nurse about, or even one of the teachers, really. So it's just about liaising with other adults that are responsible for your teenager or your young person.
I'm assuming as well with the nature of self-harm itself, they're more likely to sort of try and do something to themselves in an area that might not be visible, or is it more than actually they're doing it as a cry for help and so they're more likely to do something perhaps on arms or whatever where it might be more visible in order for people to see that they're going through something?
Both. And that there are young people will very often harm themselves in an area where if anybody is looking, they will notice. And yes, to a certain extent, of course, it is a cry for help. And but it's also almost a therapy for some young people. It is the way that they cope with the pain that they have inside. And so many young people, when they talk to me about self-harming, will say, look, once I've done it, I just feel better. People get very adults particularly, and folks who don't know an awful lot about self-harming, get very scared about it and tend to almost make a crisis of it. And actually, in some ways, we need to do the opposite and to recognise that it is just a mechanism for coping, and let's look at the root cause rather than focusing too much on the outlet, which is the self-harming. There is, in some ways, some people will perhaps berate me for this, but there is in some ways little difference between a young person drinking too much alcohol or having a smoke of something they shouldn't, as there is them burning themselves or cutting themselves or whatever. It is just another way that they cope with the pressures they feel that they're under.
So the important thing essentially is to get them to speak to someone about it.
It's about making it open and making it okay for them to talk to somebody about it, making it clear that nobody's going to judge them, that we recognise that there is an underlying issue going on, that the actual cutting or the burning or whatever it is in itself isn't the issue. It's the cause of it that needs help.
And as we said many times on the programme before, of course, the pressures for young people now are just huge with the rise of social media as well. I have had a text in from someone who's saying if CAMHS do have all these new resources, why does it still take up to a year to get an appointment after referral?
Yeah, it is still a problem, particularly for what would be regarded as routine issues. They have, as with almost all medical services, they have a grading system whereby if a GP or another health professional refers something and it's deemed as being urgent, then the young person will get in quicker, undoubtedly. So it is all about prioritising things clinically. But yet we don't have unlimited resources, and the problem, as we were talking about off air earlier on, is that as soon as you put a service in place, people will use it, and it's simply a sign that there is a need out there. So it's sort of what they used to call the M25 syndrome. As soon as you open another lane, of course, all the traffic fills it, and such is the case. Yeah, it's not perfect, and yes, we need more resources. More resources are being put in all of the time. The problem with the health service is that it seems, and most people will realise this from the UK, that the more money you put in, the more people will use the services, and so the more and more you just keep expanding it. It isn't all just about continuing to expand the services. It is all about putting the right services in place at the right time for the right people.
OK, now moving on, another thing that's been in the news over the past few days. Now this again is something that's based on England figures, but it says that sepsis deaths recorded in England's hospitals have risen by more than a third in 2 years. The numbers are quite shocking. In the year ending April 2017, there were 15,722 deaths in hospital within 30 days of discharge, where sepsis was the leading cause. First of all, just remind people what sepsis actually is.
Sepsis used to be called septicemia, which is a medical term which simply means that an infection which will have started somewhere on the outside or in the throat or in the tummy or something has got into the bloodstream and has made you sick throughout your body. So it is an infection that simply pervades the whole body, and it can be life-threatening, undoubtedly. It can become dangerous very quickly if you're not careful. Having said that, we're in a very fortunate position. We have got loads of antibiotics nowadays, but it's all about diagnosing it in the right time and getting the right services and the right medicines into you relatively quickly. One of the reasons I would suggest that the statistics have come out and look so shocking is that I think we're much more aware of sepsis now than we were even a couple of years ago. I'm tempted to say it's become an in vogue thing. That makes it sound as if we're making light of it. It's a really important diagnosis to make, but undoubtedly it has become much more common to talk about it. So hospitals are much quicker at actually putting a label on what used to be called shock. We used to have patients who would come into hospital and simply go into shock very quickly. Well, some of those will have sepsis, and now, of course, a label has been put on it because we're able to diagnose it better than we used to. So I think the statistics are partly increasing because we're diagnosing it more, partly increasing because I think the general public is more aware of it, and so they are presenting earlier. and we're picking it up earlier. And actually, that's the point. We want to do that. As I said earlier on, the problem is that the more resources you put in place, the more they'll be used. I'm not advocating that everybody should go to A&E as soon as they have a sore throat. Of course not. But, I think if you have a sore throat and it's not getting better and you've been given antibiotics by your doctor and you're still increasingly feeling unwell, then you should be suspicious of that and you should make inquiries. It is about maybe giving meds a ring and getting a doctor to chat it through with you. We generally are relatively good at picking up danger signals, and we will get you in if you need to be in and be checked out. So I think probably we just need to be a little bit more careful about presenting ourselves to a doctor if we're feeling unwell. When your child is unwell, the problem, of course, with sepsis is that many of the symptoms are quite vague. Your child may be very hot, but unfortunately you can also have a relatively low temperature child can feel quite cold and clammy to the skin. They may become drowsy. Well, of course, lots of things can make you drowsy and unresponsive, but sepsis is one of them. So basically, if you're a parent and you have a child who is unwell and not getting better in the way that you feel they should normally do, talk to somebody about it. Give meds a ring. Have a chat with your doctor. They will generally be pretty good at picking up the danger signs, and they'll get you in if they need to have a look at you.